So these are the three gross findings that you should write whenever it comes in exam. Weight, number 1, weight is increased. Number 2, the urethra is changed into slit-like structure and you can see the nodules. And number 3, the color of the nodules. So these are three classical gross features of BPH. What are the classical microscopic features of the BPH? Remember, there is proliferation of both glands and stroma. But whenever you look at the gland, when it is a benign lesion, okay, so benign prostate always have 2 layers, okay. So it's just like breast, okay, so it has 2 layers. So inner layer is the tall columnar epithelium and the outer layer is flat basal or cuboidal epithelium. So always prostate, normal prostate has 2 epithelium. So that's a feature of benign nature, okay, it's benign. That's why it's showing 2 layers, okay. So there is increased proliferation. So first thing is there is increased gland to stroma ratio. So there is increase in the gland, but stroma is also increased. So first feature microscopically is that there is increase in the gland to stroma ratio. Both are increased, gland and stroma appear increased, okay, but normally, so both glands and stroma are increased, number 1. Number 2, if you look at the glands, it shows you 2 layers. That's benign. That means it's benign. The inner layer is columnar, the outer layer is basal. Okay, but there can be more proliferation of the epithelium. So what happens? So whenever the epithelium starts proliferating more, it will go into the lumen and form papillae. So there can be papillary projections which can be seen in the glands. So there is glandular proliferation, but there are papillary projections which occur into the lumen. That is what you can see that. Okay. Now number 3 is, because they might be, there are more glands, so more secretions, so they can have corpora amylaceae inside the acini. So inside these glands, inside these acini, you can see the corpora amylaceae.